Hi everyone, welcome to ELI, the place where you get your daily dose of inspiration for entrepreneurship. And today we have with us Mr. Vikas Karade, the founder and CEO of AlgoSurg, which makes algorithms for surgical automation. Vikas is a graduate of IIT Bombay and was part of Y Combinator program in 2018. Um, Hi Vikas, welcome to ELI.
Hi, Priya. Thank you. Thank you for the invitation.
I would request you to introduce yourself to our audience, please.
Okay, so my name is Vikas. I'm coming from a very small town near Nagpur in Maharashtra, and so always been very passionate about technology. And when I was in IIT Bombay during the last few years, I got very interested in medical device technology while I was working with Dr. Manish Agarwal uh, from Hindu Hospital. He's a very innovative surgeon. Then I had a job, but I left the job in like 3 months and started for PhD to kind of work on the invention I have been doing during my master's. And that invention then I spinned off in this startup, AlgoSurg. So in 2016, we started a research for 2 years, and in 2018, then we started the company in US because we were like selected by Y Combinator. So last 3 years, we have been working on medical devices. So last 10, 15 years were amazing. Met a lot of great people like presidents and prime ministers and a lot of great founders, worked with some of the great researchers, amazing life, amazing people we met, professors and all, fell in love many times, many failures, a lot of great journey in the startup. And I hope next few years, the future will be even better. Yeah.
Okay, would love to know about the journey. To start with, let us first understand what is AlgoSurg about, since it is a medical device and it's a little
Yeah,
complex arena. Tell us in a very detailed manner and make it a little simple for us so that everybody can understand.
sure. Yeah, so fortunately, the definition and what AlgoSearch stands for has not changed since the beginning. AlgoSearch is simply algorithms for surgeries. So if you look at any process like manufacturing process or any industry you go, everything is now automated. You know, if you look at any car factory, even the car manufacturing is automated with robots. But if you want to automate certain process, you need algorithms to first simulate that process. And AlgoSurge started to do that, to simulate surgeries. So in nutshell, what we do is we digitize the human anatomy in three-dimensional environment, and we simulate surgeries. And then we use that simulation to automate certain surgical parts. So for example, if you know the simulation of surgery, which is basically where to cut the bone, what implant to use, you can do all that in virtual environment. Now you can feed this information to either a robot to perform a surgery. We are not there yet, but you can also use that information for guidance, to interpretive guidance. You can feed that to AR glasses and show interpretive guidance during the surgery, or you can use that simulation to create certain instruments automatically, which you can 3D print and use in the surgery in a very, and that helps to improve the surgical efficiency. So that's in the nutshell algorithms to simulate surgery.
Okay. So tell us about the industry. What are the different happenings in the industry, especially the one you are operating in? I understand since you are doing research and you are building such a product or a platform, then there would be other players as well who would be doing research and building similar platforms.
Yeah.
So what's happening in the industry, where we are going in the surgery domain, and in what timelines when we can see not doctors but robots performing surgeries and all.
Yeah. So medical device is one of the industries which where the changes do not happen very fast, because this is not a product for general public. It is for patients who are undergoing surgery, and it's a matter of their life. So medical devices have a very long journey, right from conceptualization to to final product. You have to first make a prototype, a product, then do a lot of clinical trials, which take itself like 2 3 years. Then you have to get FDA to prove that this device is not harmful. That takes 1 to 2 years. So a very long journey to just make the medical device, and then you can talk about you know sales. And that's why uh, apart from any other industry, medical device is the only one where it is not completely automized. It is not completely robotized. There are no completely automated robots yet. Nowadays, after many years, nowadays you will find certain robots being used in surgeries, just introduced, but they don't, completely automate the surgery. They just help surgeon, assist surgeon. So uh, what's been happening in medical device industry is I'm seeing from last 10-15 years, many things are still same. The surgical methods are still same, the conventional methods. And now you are seeing some new technologies coming up, and that is the opportunity for some of the entrepreneurs to really work in this field. Even now there are very few people who are working in this field. So if I look at my own competitors, now there can be hidden competitors, you never know, but the people which the startups which hardly 10 are working on 3D simulation of the surgery. If you look at startups, big companies is also working in. Even the big companies, there are like very few major companies in this industry. And by the way, we work in orthopedic industry right now, not in the soft tissue surgeries or anything. So, so to find a optimal way for a startup to really succeed in this medical device market, where the medical devices of class 1 or class 2. What I mean by that is these classes are based on the invasiveness of your product. So like our product actually helps surgeon to cut a bone. So that's like very invasive. So in this kind of products, in this kind of industry, it's still there is still not a great way of how a startup would succeed. What we believe is, to succeed, we need to partner with some of the big implant manufacturers, because they know how to get the product very fast in the market through clinical trials and FDA. So it's, for us, it's kind of learning. We are still learning that after making this product, how would we exactly serve it to millions of patients.
Okay. Uh, at the beginning, you had mentioned that anything relating to pharma or medical industry, it takes a lot of time to build and
Yeah,
a lot of time to realize the revenue out of it.
yeah.
Of course, the approvals and all. Having said that, can you help us understand how are you managing the finances till the point where you have not got an revenue source or something like
Yeah, yeah.
that?
So from 2016 to 2018, it was not a real startup. It was more of a research. We had started a company, but our main goal was to just perform research. And for that, we got some grant funding from government of India. That was because my PhD research was very well recognized, and we had some traction, and some surgeons were really happy to work with us. So there are a lot of orthopedic surgeons who are like hungry to get their ideas out. They want to work with engineers and uh, uh, build their solution problems into get solutions for their problems. So for 2 years it was like that. In 2018, we actually started the with a aim of making a big company. And the first funding was from Y Combinator itself. They funded like to $120,000. Then some angel investor came up. They loved our idea. Then there was a company in India who wanted our solution. So we sold that solution for them. It was our first small surgery planning software. So from there we made some revenue. Then this year we got a project from Intuitive Surgical Foundation, to build a surgical simulation for training purpose. So they funded us some funding. So it has been like that. Every time there is someone coming to us, collaborating with us, funding us, and we are developing. But we want to get out of this. We want to get out of this funding and grant award thing. We want to sell our core product and actually make revenue. And that's the plan we are having for next year. So we are partnering with some 3D printing companies to get our product finally, first in the Indian market, then getting FDA, and probably then in the other markets.
Tell us about your team. How did you find the people to build this entire thing, and who are they?
Yeah, so our team kind of keeps on changing because we are still learning along the path what to develop, who to hire, what not to do, what to do. We need two kind of people. One is the people who can develop algorithms, and then there are people who can do clinical testing work. So whatever we develop, we have to implement in the surgeries, get some feedback from the surgeons, then redevelop or re iterate, which is a very slow process compared to any other IT product. So initially we had around 10 people. Most of them were clinical uh, 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 experts. All the algorithm development is done by me and my co-founder, uh, uh, most of it. Then just before pandemic, uh, all the clinical work stopped. So we had to let some people go. Some people left for higher studies or doing something else. So since then, we have only two people who are doing clinical tasks. And all the algorithm development is done by me and my co-founder. In 2020, since there was no clinical work because of lockdown, we just needed algorithm people, and that's me and my co-founder are good enough. This year we are hiring more people, and many surgeons. I can count a lot of surgeons in my team, although they are not officially the team members, but they do a lot of work. They do a lot of clinical tests by themselves. All we need to do is just ship the algorithm to them, the software to them, or ship whatever product we develop using our algorithm to them, and they just perform the surgery, record it, send us the feedback directly. So a lot of surgeons are there in the team unofficially, but mainly it is me and my co-founder. I found my co-founder at IIT when I was doing my PhD. He was doing his BTech, and I was mentoring him in his project, and that's where I found him.
Okay. Um, can you take us through the entire journey, like how it all started, and then what happened, and then what happened? At least the journey so far,
Yeah.
and what we are planning to do in next few years.
Oh yeah. Good. Yeah. So my interest in medical device started when I was doing my BTech plus masters in IIT Bombay. In 2010, I met Dr. Manish Agrawal, as I mentioned before, and he wanted me to design certain instrument to cut the bone of the patient very accurately, and that was my master's project. I got very interested in that, but as all IITians do, I just took a job somewhere, but I didn't like it, so I just left the job in 3 months in a very unethical way. I mean, I just stopped going to the job, and then I wanted to continue that research which I was doing with Dr. Manish Agrawal. So my professor, Professor B Ravi, he offered me a PhD at IIT Bombay. So for in 2 years, I finished my PhD, and during PhD, I invented this algorithm. In 2 years, I finished my PhD work, and then for next 2 years, I was working on just exploring the commercial path of my innovation while being in a PhD. So that invention was basically called it as X-ray to 3D, which is basically an algorithm which converts a two-dimensional X-ray image into a three-dimensional model, and that got a lot of attention. A lot of surgeons tried to connect me, saying that why don't you use this algorithm to perform surgery planning in 3D and help us in surgeries, and all that attention came up. I published a lot of research. So a lot of researchers and professors appreciated that product. I got many awards for that. I was called in President's House in their program, Innovation Scholar program. Stayed there for like two weeks, meeting some of the top people around the country, top decision makers in the country in medical device field. So that kind of gave me a lot of boost. That let's not about entrepreneurship, but let's make this technology to use for some people. I met APJ Abdul Kalam sir. He also the first question he asked me that when are you deploying this technology to a surgeon or a patient? And so all those questions keep coming in my mind. And then I met Amit Maurya, who is my co-founder, and he and me just decided, let's get out of this academic circle and let's just make something, not about startup or anything. Let's just make something, give it to someone, they will use it. And 2015, mid 2015, we started planning how would we do that, how would we get funding for this research if we want to complete this research and make it into a product. Then the government of India sent me to Silicon Valley. There I met a lot of great founders, went to Google and all, and kind of got into that startup, or actually at least the innovation mood. And then in 2016, we started this research for 2 years. Our plan was to use that technology, X-ray to 3D, for 3D surgery, to make a 3D surgery planning software for surgeon, where surgeon can just look at the 3D model of a bone of a patient and perform the surgery. So that happened for 2 years. And then in 2018, we got into real startup mode, that let's make it as a big company and let's solve more problems in this field. And that's where we applied to Y Combinator. And then it became more serious. Yeah. So since then, 2018, we are making products for surgeons, understanding surgeries, attending a lot of surgeries, understanding the problem, solving that, doing a lot of iterations of product on various surgeries. And now we are kind of ready to go for some clinical trial. We're doing some clinical trials, and I hope by the next year, we'll be selling some of our products. On the meantime, during a pandemic, we also realized that let's make something out of our technology, which will not need clinical trial or FDA. And that's where we started another project for clinical training purpose. So we use our simulation for clinical training purpose, which we can build much faster and sell much faster. So that is another thing which in next year we would be like to we will like to kind of commercialize it. So for that, we are looking for a lot of partnerships to use that product and commercialize it, either from 3D printing companies or some medical device companies. So all that is going on. I hope all the plans will work.
Okay. Would be very interested to know about your Y Combinator journey. So would like to first understand why in the first place Y Combinator invested in you, because they usually invest in scalable business models. Also, they don't only invest in you, they also take you in a 3-month program, and there are different logistics and learnings associated with it. So tell us about it.
Sure. So YC definitely, or any investor invests in a company where it can be scaled much faster. Within 1 or 2 years, you will have a Series A, and so and that's why we have a lot of challenge to get investors, even in Silicon Valley, any medical device company, class 1, class 2 device. YC selected us because so YC majority they take companies who are like very scalable, but they also take some innovative companies who are like completely out of the box. So what we are doing, very few, I think none of the startups are exactly doing what we are doing, at least not in the media. If they are doing it, in secret, I don't know. But what exactly we are doing, very few are doing. And so YC sometimes take a few companies who are solving some of the toughest problems. And YC doesn't select a company, they don't select the idea, they select the founders. So if there are founders who are very brave enough to solve some of the toughest problem in the world, they love it. So they knew it. During the interview, they asked us that what time will it take, how much time will it take for clinical trial, how much time will it take to FDA, and we honestly told that, hey, 2 years at least for trials, 1 year for FDA, everything then. But they selected us. And what I can understand is this, that they select the founders who can solve some of the toughest problems around the world, because that's what YC stands for. It is for, they are about making something people want, right? So among from the majority of startups which can scale fast, like IT companies, e-commerce companies, they also take some tech companies. And in my batch only, there were a few deep tech companies, very few, but there were, and YC2 select them. Yeah. About the learning, I would say,
yeah. So I was going to ask that, what did you learn in YC? Because most of their training programs are also again based on how to scale your business, how to find the problem statement, etc. So even the mentors are from not from medical background, they're from startup and business background. So tell us what you learned.
You have a great knowledge of YC mentors and all. Yes, there were very few now there are few. At my time, there were none in medical device. So they hired one external partner for some of the medtech startups, and that was the only guy about medtech in the YC. So YC has great. YC can transform your company and founders to think big, to have growth mindset, how the founder should be, how the company should be, everything. Uh, what they, not only they, but anyone, any accelerator might lack is to give a perfect pathway for medical device startup, because there is no perfect pathway yet. I mean, I recently read an article about YC where they uh, mentioned that it will take 5 to 10 years to actually find out or actually crack the methodology for a startup to succeed in medical device, deep tech, class one, class two. So, however, even then, we were helped because of from the YC because of the kind of attitude they built into us. You know, they can. Uh, I will not go into detail, but they made us think much bigger than what we were thinking. In shortcut, I would say that we were thinking of just creating a software for surgery planning using our technology. They said that why don't you use this software and feed it into a robot to automate the surgery, you know. So that's how they can hear you out, and they can completely transform your thinking about your company. And that is just one example I gave. They can do it from different perspectives. So they transformed us as a founder, I would say, in nutshell.
Okay, fair enough. Um, Now tell us a little bit about your personal side of an entrepreneur. Help us understand how do you stay energetic throughout the journey, because I understand you being a founder, you have to work at least 12 hours a day, 7 days a week consistently. You cannot take a break. If you take a break, the business will suffer, or some processes may break out. So tell us, how do you stay consistent and energetic throughout the journey?
Yeah. So yeah, one of the good thing is that we can work anytime we want, you know. And yes, that can sometimes extend up to Saturdays and Sundays also. But uh, 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 about the energy thing, I would say it's the passion we have to make the technology. So since the beginning, when we started this, it was not exactly about commerce. It was not exactly about. Nowadays, startup has become a buzz. You know, every corner you will find some startup founder. When I started with my co-founder, it was not a buzz. You know, it was a difficult path or alternate path to take, even for IITs. You know,
Mm.
uh, but what we found is that it's a you know, Priya, it's a great privilege we have. It's a great privilege to work with some of the top surgeons around the country. These surgeons who have no time other than their surgeries and patients, they give us like hours of time just to teach us their surgical problems, find solutions with us. And when our solutions benefit them and their patients, it just feels privilege. And I think I cannot have this privilege anywhere else. So the energy of the surgeons and the feeling of this privilege, that keeps us motivated and energetic all the time. Yeah, so I wait for a meeting every Saturday. Every Saturday we meet with a lot of surgeons. That meeting goes for hours. I always wait for that meeting. What happened in the surgery last time with our solution? What feedback do you have? Are we ready for now commercializing it? Can we scale it up to different surgeons? So it's the surgeon's energy to solve the problem, and the privilege we have to do that. That's what keeps us going and energetic.
Any challenges that you have faced during your entire entrepreneurial journey?
Yeah, I mean, a lot. Like last year was a big deal. We had planned a big clinical trial for one of our products. Had a partnership with a 3D printing company, but that lockdown and all, it kind of destroyed everything. So last year we couldn't do much, and then we had to like rethink about our ideas. Not only that, what we would do when the lockdown will be over, how will we get everything back together, but also that how to use this 1 year time more efficiently, and can we build something which will never go through these kind of problems. So that made us rethink ideas, and we got then another support and grant funding from a company to build a surgical training module. So the first half of that last year was very challenging. We had no money almost, but when we like got up with our whiteboards and rethought about all the ideas, the second 6 months were very hardworking, and I think that hard work paid off this year now that we are working on some new project. So yeah, so that was I think the biggest challenge was last year. Yeah.
Any failures that you have gone through as an entrepreneur?
Well, many failures actually. So there were failures to recruit. We recruited some people, say thinking that amazing algorithm developers, let's take them, but not always a good decision. Uh, uh, there were failure in products also. I mean, we have been working on one product for years, uh, and it's basically a 3D printed custom instrument for knee replacement. Now we think that this product might not work. Looking at that, the robotics and all is coming up, so we kind of changed that idea into something else. So yeah, I would say product wise that was a failure. Recruitment wise, one failure was there, that we hired some people thinking that uh, something will happen, but in the end we realized that in the beginning of the startup you have to do everything. You should do everything in the beginning, at least if you are good at it. uh, so yeah, uh, that's the only thing. Otherwise I don't actually remember any failure as a failure. There were challenges, nothing as a failure, I would say.
Uh, what would you say is the meaning of entrepreneurship? How would you define the term entrepreneurship?
So there are a lot of definitions. I mean, the general definition is that if you can, you know, if you can build something for the people of the world and make some money out of it, the money part does come in the definition of entrepreneurship. That's the definition in reality, in generally accepted definition. For me, I would say I'm very passionate about just solving the problem in the world and putting a big impact in the world, which can change something big. For example, Elon Musk is doing, he's thinking about going to Mars. Now, he might have a lot of commercial plan also, but I think the majority of that idea is to change the civilization, right? So something which can change the world completely, the way people think, doing things, the way people will survive in the planet, from short range to big range. From short range, like can I get my eggs online, or milk online? That is a small change in the society, to a big change that can we have our civilization on Mars. So whatever changes or impact you can put in the world with your idea, I think that is entrepreneurship. And once you do it, the commerce kind of follows it, so it kind of matches with the definition generally accepted also.
Absolutely. My final question to you, tell us what are the different lessons that you have learned as an entrepreneur. I'm sure they are some special lessons because you operate in a special industry and with a special product. Tell us about those lessons so that we can take away from here and apply it to our ventures. And more importantly, we
Yeah.
don't have to go through the same learning process that you did.
Okay. Yeah. So I would say for the medtech entrepreneurs, most of, so as I said, startup is now a buzz, and people just start doing uh, something new like a startup without giving much thought into it, and have seen that, and that is nothing wrong. That's a learning process. uh, but if you are doing a med tech startup, and if it involves class 1, class 2 device, class 2, class 3 device, which is basically more invasive in patient's body or surgery, always remember that your startup will be the most toughest startup in the world. Don't compare your journey with some e-commerce startup or other startup who raise funding every year and have a lot of revenue. Not may not be a profit, but revenue. You can't compare your startup with them. Your journey was going to be long. You will have to work with some of the surgeons or doctors just to understand the problem. That will take months or years. You will have to attend surgeries, understand the problem, solve the problem, making the prototype. That will take years. You will have to perform clinical trials. That will take years. You will have to get FDA before you sell the product. That will take years. It easily 4 to 5 years without any revenue. If you are a good planner like we are, then you can survive. If you're not, it will kill your startup. So you have to be ready with if you're getting into a medical device startup, ready with these kind of concepts. You need to understand it is going to be hard time for years. Very few will support you financially, uh, and it is tough. Yeah.
Well, we have come to the end of the session. Thanks for
Sure.
joining us, and it was truly a privilege to interview you. Thanks for your time, Vikas, and our best wishes for AlgoSurg and other things that you'll build in future.
Thank you very much. Thank you very much, Priya.